Hello everyone. Today we are going to discuss about electrical birds. I am Dr. Sanil Kumar, working as professor and head of the Department of Forensic Medicine, Government Homeopathic Medical College, Kozhikode. Electric burn areas are also referred to as joule burns. So electrical burned areas of skin are referred to as joule burns, and technically joule burn is an endogenous burn, that is burns that are produced due to release of heat from the body on application of electric current. So the release of heat is from within the body, so it is otherwise called endogenous burn. As you all have studied that electric current may be DC direct current or AC alternating current. Which is the most dangerous current, whether it is alternating current or direct current? So alternating current is 4 to 5 times more dangerous than direct current, and some factors are influencing the damage that are caused to the body by electric current. So the electric current, the effect of electric current on human body depends upon several factors like voltage, amperage, duration of contact, contact with earth, alertness and resistance. So first is about voltage. So voltage of domestic supply is about 220 to 240 volt, and the voltage of power supply, that is the power lines, it has a voltage of about 440 volts. So our domestic supply voltage is to 220 to 240, at an average 230, and the voltage of power supply or the electrical lines is 440 volt, and the voltage of main power line, that is the high tension or the high in intensity current, which is coming from the power station to the substation, it is about 20,000 volt to 30,000 volt. So what happens is that if the voltage is more, it will cause more damage, and however no damage is caused by current up to 50 volt. So our voltage of domestic supply being 220 to 240 volt will cause a certain amount of damage to the body. Next factor is about the amperage. So the domestic supply, the household supply amperage is about 5 amperes, and the amperage of power supply is about 15 amperes. And in the household supply or the household connections, we know that we are having power plugs or high voltage high ampere plugs for running fridge, washing machine, mixie, electric iron, etc. So that power plug is having a supply of 15 amperes, and the normal normal plugs are having an amperage of 5 ampere. So the amperage is directly proportional to the damage, that is more the amperage, it will cause more the damage. And it has been calculated that if the direct current is having more than 200 to 250 milliamperes, and in case of alternating current 70 to 80 milliamperes are fatal to our human body. Then the third factor is contact with the electric current. The more the duration of the contact with the electric current, more will be the damage. Next factor is the contact with the earth. So better the contact, more the damage, as the electric current has a tendency to pass into earth. So from the source of electricity, it will pass through our human body to the earth. So if we are coming into contact with earth, the electric current will easily pass through our body, and if we are not in a position with contact to the earth, we will escape from electrocution. The next is about alertness, and the damage is less in a person who is conscious, alert and prepared to receive the electric shock. Then the next factor is about resistance. More the resistance of the body, less will be the damage, and resistance offered by dry skin is 2000 to 3000 ohm, and the resistance offered by wet skin is 200 to 300 ohm. So it is advised not to come in contact with an electric source with a wet skin, because the resistance offered by wet skin will be very less, about 10 times lesser than the resistance offered by the dry skin. So there are three types of electric burns: contact burns, spark burns and flash burns. So what is a contact burn? So the contact burn refers to electric burns due to the contact with a live electric wire. So if we come into contact with a live electric wire, there will be a wound of entry as well as a wound of exit. Very rarely just a blister formation is seen at the wound of entry, and there will be no wound of exit. So the classical finding is a wound of entry and a wound of exit. The second variety is spark burns, and these are electric burns which are caused due to sparking of current, and these sparking may be caused by loose electrical fittings, and in spark burns the typical appearance is a pitted lesion. The third variety is a flash burn, and these are electric burns that are caused on being near to the main power line, and burns result due to arcing of the current from these lines. So these are the three types of electrical burns: contact burns from the live wire in our household supply, spark burns is from due to sparking of current from loose electrical fittings, flash burn is from main power lines, electrical burn caused by main power line. What are the manifestations of electric burns? Sometimes the person may be thrown away due to muscle spasm. As soon as the person is coming in contact with the electric current, it will cause a muscle spasm which causes the person to be thrown away. Sometimes the person may be unconscious, or he can be in ventricular fibrillation, or can be in a respiratory arrest, or maybe in a suspended animation. Cataract and optic atrophy may also result. Usually there is a wound of entry as well as wound of exit. Characteristics of electric burns: sometimes there can be holes in the cloth due to passage of the electric current. Sometimes there can be hole in the shoes also, or sometimes there can be no external injury as well. Typically there will be a wound of entry and a wound of exit of electric current. The characteristics of wound of entry: the wound of entry is a non-bleeding, thick, leathery, grayish white, depressed, hard and cauliflower like, typically known as a crater formation. This is a crater formation. You can see a crater here. That is, the wound is about 3 to 4 centimeter in diameter, and it is 3 to 4 millimeter depressed, and the margins are 3 to 4 millimeter raised. So it is like just like a crater formation. And sometimes there may be a blister formation, and sometimes there can be a pit at the site of injury only. Not necessarily a crater formation may be present. Sometimes there can be a blister or just a pit at the site of injury. There can be a hole, or at times due to heat there may be scorching, blackening or even charring of the body. High voltage current may cause burns over large areas of skin, and the typical appearance of the skin is called crocodile skin lesion. The skin also may get colored due to metallic pigments, and if the electrode is of brass, the skin may be colored green, and if the electrode is of iron, it can be colored black, and if the electrode is of copper, it can be colored blue, and if electrode is of aluminum, it can be colored gray. The appearance of wound of exit. So the wound of exit is classically like a laceration and is bleeding. When we search YouTube by the name Rajmohan Nair, you can find videos about this man. He's hailing from Kollam district in Kerala state, and he's claiming that he's immune to electrocution, and you can see a lot amount of videos that are produced or that can, in those videos we can see that this man is entangled in live electric wires, and he is exhibiting his skills of immunity to electrocution. Please go and watch YouTube videos about him, Rajmohan Nair, who is a man immune to electrocution. Another characteristic of electrical burn is when there is a high voltage current, there can be charring of the body, and with high voltage current there can be, in addition to the charring, there can be fracture of bones, rupture of multiple viscera, etc. Due to high amperage current, metals from electrolytes may melt and seen as small balls, mainly in the and can be carried into the tissues, and these small balls are called current pearls, and the calcium phosphate of bones may also melt and it is seen as bone pearls. So two types of balls, that is current balls, that is the metal from electrolytes may melt and form balls, which is called current pearls, and the calcium phosphates of bones also may melt and be seen as bone pearls. And on microscopy examination, the coagulation necrosis may be seen, which is also referred to as electric necrosis. Secondary complications of electric burns are paralysis, amnesia, loss of sight due to optic atrophy, the loss of hearing or speech, etc. What are the causes of death in electric burns? Death is almost sudden if there is a high voltage, high ampere current which is coming in contact with the human body, and if heart or vasomotor center falls in the line of passage of electric current, also there can be sudden death. And sometimes sudden death may result from shock. The commonest cause of death is ventricular fibrillation. And death may be due to sudden cardiorespiratory arrest due to inhibition of vasomotor center. Death may be due to cerebral anoxia due to ventricular fibrillation. Then death may be due to the paralysis of respiratory muscles. Then death may be due to mechanical injuries due to fall. This picture depicts the path of current. It can be from hand to hand. It can be from hand to hand, then from right or left hand to and it may lead to the foot, then head to hand, then head to foot. These are the four common path the electric current takes when it hits the human body. Next, the medico-legal aspects of electrical burns, and death is usually accidental, and sometimes or very rarely it can be homicidal or suicidal death, and at times death can occur due to treatment like electroconvulsive therapy, catheterization, etc. Death can occur due to electrocution. In some states of USA, electric current is employed for capital punishment, that is for causing capital punishment. Electric current is employed for electrocution. And here you can see the picture of capital punishment you do to electricity, and here the person is tied to a wooden chair, and one electrode, that is a cap like electrode, is applied to his shaven head, and the other electrode is applied to the right leg, and the current of about 200 volt and 7 amperes is passed twice for 1 minute each time, which will cause death due to electrocution. And electric current is a common method of suicide in Germany also. So these are the medico-legal aspects of electric burns. Next, we are moving on to lightning burns, and we know that lightning refers to the discharge of current between a negatively charged cloud and a positively charged particle on Earth. So basically, lightning burns. The current is the direct current, and the voltage of direct current in a lightning burn is lightning is about 100 to 1000 million volts. The amperage of this lightning current is about 10,000 to 20,000 amperes. So you can just imagine the amount of voltage and ampere this current is having. And a flash of lightning usually lasts for 1/100th of a second. Then a flash of lightning affects an area of 100-meter radius, and this is due to branching of the current. You can see the branching of lightning that is seen here in this picture. And the mechanism of action of lightning burns is the injuries that can result due to lightning are due to electric current, then due to heat, expanded and displaced air, which acts as a blast wave. So these three factors, like electric current, the first and foremost factor is due to electric current, then due to heat, and due to expanded and displaced air, which act as a blast wave. The characteristics of lightning injuries include there can be no injuries to the cloth, and we have seen that there can be injuries or holes may be produced in cloth due to electrical injuries, but in lightning injuries there may not be no injuries to the clothes, or sometimes the cloth may be partly or totally burnt, and clothes may be lying away from the body also. Shoe may be torn. There may be no injury to human body. Or sometimes body may be totally charred, body may be grossly mutilated. There can be multiple fractures, multiple rupture of viscera can occur, melting of metallic objects like chain, etc. Can occur in the body. There can be magnetization of metallic objects on the body. And lightning burns is also referred to as filigree burns, arborescent burns, or Litchenberg flowers. So the lightning injuries or lightning burns are referred to as filigree burns, arborescent burn, or Litchenberg flowers. Sometimes short notes for 3 marks may be asked like this. Describe about Litchenberg flowers, or describe about filigree burns, or describe arborescent burns. So these are all synonyms for lightning injuries. This is the typical picture of a Litchenberg flower that is occurred due to lightning strike. They represent patterns like a branching of tree, and these are seen as colored branching patterns, especially on shoulders and flanks. And this branching distribution, like an inverted tree, does not correspond to the blood vessels, and the color of these markings is due to either color taken up from hemoglobin or due to deposition of copper on the body. So the reason for this color are one, either the color may be taken up from the hemoglobin, or it may be due to deposition of copper into body. And in a living person, these marks, that is filigree burns, arborescent burn, or Litchenberg flower, these marks which are produced due to lightning may disappear in 1 to 2 days, but in death they may be confused with marbling due to decomposition. But we see that they does not correspond to the blood vessel, so this can be differentiated from marbling. And the cause of death from lightning is paralysis of brain or heart or lungs, Then that can be due to neurogenic shock, cerebral anoxia, charring, multiple fractures, multiple rupture of viscera, etc. Now about the medico-legal aspects of lightning burns, and death due to lightning is always accidental, though it may be mistaken as homicidal because fractures and tears of viscera may be seen in the dead body. The circumstance of lightning may include a person who is walking or lying on an open field or on the top of a building or under a tree or in a swimming pool, uh, and a person who is at these places during lightning is more vulnerable to injury. So it is not advised during lightning to go to open field or go to the top of a building or do a swimming in a swimming pool. So the topics discussed today was about the definition of electrical burns, the factors influencing the damage to the body caused due to electrical injuries, what are the types of electrical burns, what are the manifestations of electrical burns, what are the characteristics of electrical burns, cause of death in electrical burns, and about the medico-legal aspects of electrical burns. And lastly, about the lightning burns, the characteristics of lightning burns, were the cause of death in case of lightning burns, and finally about the medico-legal aspects of lightning burns. Thank you for your patient listening, and these topics may be asked for a short note. Thank you once again. Thank you.